Hi, everyone. I'm so excited to be here today, especially talking about this topic that we are so involved in every day. So, one of the things is that our organization is a sexuality awareness organization. So, when you think about the word sexuality, people are like, oh my gosh, what is that? So, sexuality as a whole is really about your perception of self, how you feel about yourself, how you think about yourself, and how you interact with the world around you and how they perceive you. And, I always tell people, think about how you feel when you're having a great day and you go to the supermarket, which you put in your cart. Then you think about a day when you're not having such a great day and what you put in the cart. See how that kind of dictates what you do in your surrounding and your choices you make. So in this journey around sexuality in which we're trying to, help people love themselves and like themselves and choose healthy relationships. One of the things we ran into in doing the work that we do was that many women make poor decisions based on other situations that are impacting them every day. So we were doing a lot of work around bodily autonomy and consent and just how to respect, some of the choices that you make. And in doing so, we refer a lot of young people who were making very poor relationship choices, poor choices in their environment, and just really, as they would say, acting out sexually, which I really don't like that terminology. So we would refer people, and there were young people. And when I started having conversations with them about why are you engaging in these high risk behaviors? Why are you putting yourself at risk? Why are you stealing? Why are you staying with these abusive people? One of the things that just came out as we were peeling back the layers, because again, one of the things that we create in our office is a non-judgmental, accepting space. They told me, and I use Holly as the example. She looked at me and she said, how do you expect me to respect my body when 1 week out the month anything goes? And at that moment, I literally almost fell out of my chair. I looked at her and I was like, what do you mean? Like, what is going on? And she basically told me that she engages in survival sex, she steals, she uses, unsafe methodologies from rags to toilet paper to paper towels to undershirts, whatever she can find to deal with her menstrual cycle every month. And what she said was that it amazes me that we live in a society that talks about how much they support women and girls. And in this day and age, I'm still left at basically doing this to be able to get menstrual products. And it's so funny. At the time, I was used to what everybody else was telling me about period poverty. And we're going to talk about the definition to that in a moment. And I was just like, so are you homeless? Are you in dependent care or foster care? Because that's the narrative I was used to when I basically heard around this ideal of menstrual insecurity or period poverty. And one of the things that she said was that no, I actually live at home with my mother and my siblings, my sisters. And I said to her, so why is it that you can't afford products? Explain it to me, because I didn't want to act like I was giving voice to this young person as she was telling me her authentic experiences. And she said, well, my mom is on public assistance, and after we pay for our utilities or our food, there's no other finances left over. So I asked her a question that I'm sure many of you probably don't even know exists. I said, so does public assistance cover menstrual products? And did you know that there are no federal programs that actually covers toiletries or menstrual products? And they still don't in this year 2021. Now we've been doing this work for up to 6 years now. So public assistance, Medicaid, Medicare, their WIC, their SNAP, nothing covers it. So right then, that's the biggest conversation that we need to talk about. The layers of oppression the layers of negativity and discrimination against menstruating individuals that are socially constructed to prevent people from reaching their full potential. Why are we having this conversation in 2021? Why was I having that conversation 4 years ago with this young person in my office about her basically having to steal and put herself at risk to get a pad or tampon? That's the conversation that needs to be addressed. I think that's the elephant in the room when we're talking about why we did what we did. So, No More Secrets as a sexuality awareness organization kind of fell into the menstrual movement, period, poverty space because it was smack dab in our face. So, one of the things that we're going to really highlight is resources and the responsibility of all of us to provide the correct resources for our community. So when this young person told me that, one of the things I immediately did was getting on the phone, got on the computer, and we really just started looking for resources. It was amazing that I could have been like many other people who, before her seeing me, basically were like, here's some resources. This is how you get products. So recently, I just saw an article where it's something where they're coining the phrase medical post-traumatic stress, and they're coining it because this person, this female identified individual had went to the hospital and was having pains in her abdomen, and it was dismissed. They basically said that it was because of weight, it was all these different things, but they never really heard what she was saying, and they dismissed it. Long story short, she ended up being diagnosed with cancer. And so now, because of that traumatic experience, she now has fear of the medical system because she doesn't trust it. She doesn't think they value her voice. And when I was hearing that, I was like, that's amazing that they use this person to kind of coin phrase, catchphrase that terminology, because historically that's been happening to menstruating individuals as a whole. So just think about this young person who at the time was 15 years old, who was stealing and engaging in high risk behaviors just because she needed access to menstrual products. This young person went to maybe 4 or 5 other people before she came to me. So I'm coin phrasing service or social service uh, post-traumatic stress, because sometimes when people in our community go to the people who are supposed to help them, sometimes they're harmed even more. So what would have happened if I was like the people she saw before and said, well, these are the resources for you, and she would have been traumatized again. So we basically started researching them, and at that moment we realized there were no resources. So I didn't know if you knew that there aren't resources to get free feminine hygiene products, menstrual care products to our communities. They don't exist. So at that time, we created the first feminine hygiene bank um, in the tri-state area. This was the Pennsylvania, New Jersey, Delaware area. After we created that, it was such a buzz that people were like, we need the products. We can't get to you. We need help. So from that bank, because we created something to help our community live in dignity, after that, and again, with no funding, everything we do is without funding. So let me preface this. We do not have funding for the work that we do because it's not a need in our community. After that, we created the first rapid response delivery service in the world to menstruators. So we basically will pack up a 3 to 5 month supply of menstrual products and give it to people who need it. We would deliver them, we would ship nationwide, we would do what we could to help our people live in dignity. And usually, when you hear period poverty is the inability to access safe menstrual products. And I used to use the term feminine care instead of feminine hygiene, um, and waste management services. That's what period poverty is. You will hear a lot of conversations around menstrual equity. Menstrual equity and period poverty are not the same. They are not the same. You will hear menstrual equity. Menstrual equity is making menstrual products equitable like other items that you supply. So people will talk about equitable in the bathrooms, like in the stalls, uh, organizations providing them to their employees, just like toilet paper, paper towels. It should be equitable and accessible. It should be equitable to our communities the way other things are. It should not be a luxury item. It shouldn't be taxed. It should be a necessity. Definitely agree with that. We need to make it equitable. But if the menstrual equity laws had passed and the pandemic hit like it did, my people in period poverty would still be in period poverty. Do you understand? So all the buildings would have shut down, all the schools would have shut down, all the community centers and all of these facilities that they were equitable in, they would have all shut down because period poverty still wasn't being addressed. So we're out in the communities giving a 3 to 6 month supply of products to every menstruator. So we can go to one home and give out 10 bags because, as you know, when you're in poverty, you cohabitate. Housing insecurity is an issue. Food insecurity is an issue. Utilities are an issue. So don't tell me to give my marginalized communities a menstrual cup when they might not have running water or electricity and they might be house hopping. So I cannot give them something that's going to be inserted in their body to cause further infection. Also, when we're talking about the layers of oppression against people who menstruate, because we already have gender equity, we have unequal pay, racial discrimination, gender discrimination, all of these other layers. And then also, we're trying to respect and have autonomy of our body. So I can't go to a home who's racially and culturally does not believe in an insertion. Remember, not everybody believes in inserting things in their body. So I'm teaching them autonomy. So then I'm going to say, hey, well, you have to use this because this is the most sustainable option. No, I have to ask them, are you comfortable with insertions before I can give anything like a menstrual cup or anything? So those are other things we need to consider because oppression does not alleviate choice. So we go into the homes and give a 3 to 5 month supply. If people are open with insertions and they have running water and they have waste management, we can introduce them to cups and things like that. But we do not take away what they're used to, but we kind of add that as an extra option so that they can learn about it. So the pandemic hit. We were doing 85 deliveries a week all around the city, all around the tri-state area, shipping nationwide. We went from 80 deliveries a week to 275 deliveries a week. Again, we don't have funding. I'll keep saying that because menstrual insecurity and period poverty is not an issue in our community. Remember, in most states, menstrual products are still a luxury, unlike pixie sticks and nuts and Viagra and all this other stuff, but they're a luxury item, so they're still taxed. 275 deliveries a week we were doing at that time because everything had shut down and no one else was going directly to the menstruator to give them products. So at that time, we realized that a lot was going on. Period poverty was the singular issue that we were addressing, but period poverty unfolds a multidisciplinary amount of deficits in marginalized communities. So just think about it for a moment. The pandemic hit, everything shut down, and everybody's forced into their home. So if you're privileged, you can stay in your home, you can cook, you can do TikTok videos, you're fine. But what about the marginalized communities? And not just the people in poverty. What about the people who were like lower middle class, who were in the serving industry? All of them lost their job because the hotels shut down. All the serving positions shut down. Remember, a lot of women are in these positions. So hotels, hospital cleaning crew, everything shut down. So we had our people who are already in poverty and the people whose economic stability had just shifted. And most of them were women. Women had to stay home because their children couldn't go to daycare anymore. They couldn't go to school. But do you think that anyone thought that we needed to add menstrual products as a crisis relief? Because how are they going to afford them or get them? Nope. No one thought about it. So during that time, we were doing 275 to 280 deliveries all around the city, tri-state area, shipping nationwide. In the back of our cars, having women crying because guess what else happened during that time? Everything went virtual. Everything had to be done on a computer. And not everybody had Wi-Fi. Not everybody had a computer. So we had women and grandmothers and girls in the back of our cars using our phones, trying to get resources, giving them menstrual products, taking them somewhere they go to the bathroom, taking them somewhere so they can get cleaned up. Because what else? All the public bathrooms shut down. Everywhere the people who were marginalized, who didn't have running water, everything shut down and basically was inoperable and unattainable and accessible to these communities. What was the breaking point was when a young girl almost got shot in the back of someone's house because she was using a hose to clean herself off while she was actively bleeding because she didn't have access to water. At that moment, we realized we needed to open up a safe space for our community immediately. That was October. October, we started a GoFundMe to open up the first menstrual hub and wellness center in the nation. We opened it up on February 20th to create a safe space for our most vulnerable communities, which is anybody who menstruates, to be able to get access to a toilet, running water, free menstrual products, uterine, menstrual health and hygiene care, therapy services, a computer room with Wi Fi, and a safe space room, which is actually called the Breonna Taylor Safe Space Room, with 2 futons, a television, and other toiletries from toothbrushes to toothpaste to deodorant to underwear. Everything our community needs to live in dignity. And we did that because our society as a whole, we do live in a misogynistic patriarchal society that somehow doesn't think of the wellness of menstruators as something that's top priority. I think it bothers me that in 2021, we're still having this conversation and that no one is actively addressing it from the perspective of the community. So, the reason we opened up the SPOT, which is Safety Programming for Optimal Transformation Hub, during a national pandemic when the rest of the world had shut its doors, was because the most vulnerable and marginalized populations happen to be women and girls who were affected most adversely because of the pandemic, and people weren't creating safe spaces for them. Also, let's add, when I'm talking about the layers, child abuse had increased, sexual abuse had increased, intimate partner violence had increased. All of these were impacting our communities. So they needed these people to get them what they had to have to survive. And no one else was thinking about how we could do that. So that's why the spot opened during a national pandemic on February 20th. And we have been servicing people since. We still are not funded by the city of Philadelphia in which we are located. We're not funded, by anything because, again, menstrual health and care is not deemed a necessity. Uh, when we're talking about resources for communities, I want to give you 4 key points to always remember. Are the resources equitable? Are they equitable for everybody you're serving? One of the things that No More Secrets has been intentional about is listening to the voices of the people who are affected. I'm going to say that one more time. Listening to the people who are affected or impacted, because their experiences need to be uplifted and honored so that you can create programming and services that best meets their needs. Is it equitable? I've seen programs where people say, oh, we give out products or we do whatever. Do you know when the spot opened, we had about 5 to 7 calls from homeless shelters saying, hey, people keep giving us menstrual products, but we can't use them. Can you take them? Yes. So people will say, hey, we want to give them to homeless shelters. Okay, well, I'm trying to prevent the community from going homeless. Homeless shelters only have a certain amount of turnaround. So sometimes giving them mass amounts of product are not necessarily going to benefit some of the community. Do you know that most people who live in poverty or dealing with socioeconomic deficiencies or problems aren't connected to a system? They're living at home in their communities trying to survive. So sometimes when you're giving to an outward source, It's not coming to the community because they're not connected to these sources because they don't know about them or they're just trying to live. So don't always think that they're connected to a social worker or a social service agency or this. Sometimes they're just at home. So that's why we're intentional of giving directly to the menstruator. Is it equitable? When you create programming, is it equitable to everybody or is it only equitable to some people? Is it accessible? The pandemic came and all public transportation shut down and people were having them try to go out of the county. How are they getting there? Is it inclusive of everybody's cultural, racial, gender, their beliefs? And is it available? Please stop giving out resources where those people are no longer in business or they no longer have products or they don't even know what you're talking about because they are under the new management. Don't re-traumatize our community. So that's some of the stuff that we do in our community around menstrual health and wellness. I want to open it up for a couple of questions. I see some in the chat, but I just wanted to open it up for questions. Oh, thank you, my outfit. Oh, I'll tell you about my outfit. So during the pandemic, again, we went from 80 deliveries to 200 and something deliveries, and we still do a lot of deliveries. Let me tell you, we do, how many deliveries do we do now, Naya? Over 100 deliveries still a week, and we still have over 1,000 people coming to the hub. It's crazy. Still through crowdfunding and donate. You can always donate. Our website is all on here. Please donate to our GoFundMe. We have an Amazon wish list. Please support our initiative. So yeah, so we were really depressed and we were just like, we can't do this anymore. We're tired. So my partner told me, why don't you act like you're going to Disney World or, dressing up as a princess or, because I love Disney. And we started doing that and it just changed our attitude. It changed our community. So we always feel like we're giving a gift of dignity instead of giving pity. So people really love that. Okay, did anybody have any questions? Am I reading the questions? Am I doing the right thing, ladies? Am I supposed to read them?
Yes, you can go ahead and read the questions.
Okay, I think I see a couple in the chat. Thank you for talking. Aaron from Facebook Live. How can I help those in need in my area since I don't live in Philadelphia? Great. So one of the ways you can help is collect products in your local area, kind of put it out there, is anybody in need of menstrual products? But one of the biggest things that everybody can do is educate people around this disparity. People honestly don't know. When I'm having conversations, the first thing I'll come and say, hey, do you do food drives? And people are like, yes. Do you do turkey drives? Yes. Back to school drives? Yes. Clothing drives? Yes. Why do you do those drives? Because people can't afford them. They're having, issues, families are suffering. How many of you do menstrual product drives? Crickets. So that's what it's about. These same families that need all of these other things definitely need menstrual products. It prevents our women and girls and menstruators from reaching their full potential. They can't go to school. We have young people like the person I was servicing. Her and siblings just stayed home. They just didn't go because let me talk about this. I'm going to talk about the cycle of poverty very quickly when you're impacted by menstrual insecurities and period poverty. I'm in poverty. I might have one or two uniforms, two pair of underwear, maybe. I don't have a washing machine in my home. So let's think of the pictures, and there's about 5 of us, my mom. And remember, our periods sync when we live in a house, right? Okay. So we have that. If I go to school and I don't have proper menstrual products and I can't get them in school and no one else can get them, so I'm leaking, I'm being embarrassed. So, okay, I don't want to go because I'm embarrassed. Or I have a period, it leaks on my underwear. I have one pair of underwear and it gets on my one uniform. I go home, then what happens? My mom doesn't have a washing machine. Our water doesn't even work all the time. So how am I going to clean it? So then that prevents me from going again. So I'm still staying home. Do you understand? So sometimes this cycle of poverty isn't about this idea that people don't want to do better. Sometimes this cycle and this socially constructed system of oppression keeps people from doing better. Second thing is people who are in these welfare to work or earn programs. We give them the cute little suits, couple of pair of underwear, but no one thought to give them menstrual products so that they can make sure they can go to work. Marginalized, Black and brown, Latina, refugee communities don't have the best health insurance. They're underinsured or uninsured. So what happens? They have irregular periods. They have fibroids, endometriosis, menarche, all of the PCOS. So they bleed even heavier and they have clots. So what happens? They need better menstrual care, menstrual products, menstrual hygiene. Again, if they're going to school, they're bleeding out. If they're going to work, they have to go to the bathroom all the time. All of these things keep people from reaching their full potential. Cycle of poverty. This is amazing. Thank you. If you don't live in Philly and aren't sure how to get the word out, would you suggest donating products to local schools or clinics? Yes, definitely. Schools are always usually in need. Usually they leave it up to the nurse, and that's not fair because, again, this is not a medical issue. We are not sick. It should be in the bathrooms so that people, I never understood that. I get a note from my teacher. I go into the bathroom. Okay, my period is on because, again, we don't always know as kids, as young people. I have to put tissue down there, go out the bathroom, walk back to the teacher because I can't use the same hall pass, right? Go to her, get another one to go. You know how much instructional time our young people lose because of lack of attention to menstrual products? Why not just have them in the bathroom so that people can access them and have them if they need them? Oh, right on the mark at 4:30. Look at me doing good. Any other last questions? So the Spot Period is the first and only menstrual hub and uterine wellness center in the world. It's a drop-in center where people could come and get products, and in addition to education, counseling, and resources and toiletries, and we also still do our delivery services. Are there any items your Amazon wish list that are most needed at the moment? Yes, on our Amazon wish list, the heavier pads are the most needed. The purple overnight pads, because again, it's almost like, you know how when you work with kids and they leave foster care or whatever, and you're like, you can have as much food as you want, but you're constantly eating because they're not sure when they're going to get it. Same thing. Even though we're giving them products, they like the stability, the safety and the thickness, because they don't know when they're going to get more. Even though we're giving them a lot, it's still in their mind, like I might not get another one. So they still, and they have irregular periods because, again, they're not going to the gynecologist, they're not going to the doctor because of healthcare. So this social construct around our marginalized community. So really the thicker pads are what we need the most. But something that's not on there that we also need is toilet paper. Because again, people are coming now. So they're coming, they're getting freshened up. So that's why we have the underwear on there. So we always need toilet paper and trash bags. I think that's it. I'm right on the mark. Any more questions?
There were a couple here. Kathleen from Facebook Live asked, do you accept product donations as well as financial?
Yes. And the easiest way is to do our Amazon wish list because it ships directly to our main office. So that way we don't have to worry about anything. If you're in the area, definitely you can drop it off. But definitely we accept both. But they have to be unopened.
And Sam from Facebook Live asked, can you volunteer?
Yes, we do on our website. We have all those forms on there about donations, around volunteer opportunities. Definitely. You can, and you don't have to do deliveries, you can come and unpack boxes because, again, we get donations, we get shipments. So we have to unpack, we have to sort, and we have to pack bags for our communities who are asking for products. And you might be someone who wants to be an advocate. You might want to reach out to brands. You might want to reach out to car dealerships because we're still trying to get a van because, yeah, we need a van. You might want to be a person who's reaching out saying, hey, they're a nonprofit. They're doing something no one has done. We know it's a taboo subject, but hey, do you want to support them in any way? So we always need people to help advocate and educate on our behalf. Thank you. Bye-bye.